Hello, I'm Jim Demo with Clark County Close-Up. Thank you very much for meeting with us.
You're welcome.
Well, so let's talk. What are some estimates on the number of people with chemical dependency in Clark County?
Well, the prevalence rates from the state indicate that at any given point in time, there are about 1,300 young people, youth in our community who need treatment, and about 10,000 adults. And of that, less than who need it get that treatment, less are involved in treatment. And we serve about 225 youth in any given month and about 1,300 adults.
Is it average for, is Clark County,
Yes.
it's average for that? And the numbers, are they growing, they staying?
You see more people coming in.
So Lifeline serves about 3,000 individuals every year, and it's been pretty steady. We're not seeing a huge increase. We do see drug trends kind of wax and wane, but as far as the numbers, they are pretty static.
And that seems to be consistent
Okay.
across the state.
Are there any estimates on the financial impacts of drug and alcohol use for this county?
Well, in conversations with the Sheriff's Department, for instance, one of the reasons the sobering unit started certainly was to lessen some of the need for the jail system. But in conversations with them, they indicate that about $6.5 million of their budget is really for medical services. And of all the individuals that go through the jail system, about 70 to 80% of them are dealing with drug and alcohol issues.
Wow.
And nationally, I mean, the National Institute of Drug Abuse indicates about $600 billion is spent dealing with substance abuse issues across the country. That's incarceration, that's drug enforcement, that's
Healthcare costs.
That's lost productivity at work, that's family issues that come from this. So this is a major cost to our society.
Okay. What types of services does someone need who has either an alcohol or drug addiction?
You know, the alcohol and drug affects so many facets of an individual's life. So some individuals might need housing, some individuals might need employment supports. Most individuals need some type of treatment supports, from an inpatient stay to a detoxification stay to an outpatient stay. Typically that's the route most people take and need to get their life in place so they can start working on some of these relationships and start holding a job and start becoming members of society again.
And so when you're saying detox, what exactly?
So the detox process is to get the physical gunk of the drug out of your system. And typically it's a 1 to 5 stay in a detox unit. Okay. Lifeline operates the only publicly funded program in the county. The hospitals do offer some of a lot less volume than Lifeline does.
Okay. And what's the role of the county's alcohol and drug treatment program?
Our responsibility is we have a contract with the state. So our responsibility is to make sure that we have a provider network of alcohol and drug providers who can ensure that treatment is available to any citizen within the county that needs it. And we are responsible for holding the contracts with those providers and monitoring those contracts and working in partnership with them and other community members.
Okay, and then Lifeline is one of these partners.
Correct.
Yeah, tell us what's the role of Lifeline?
So Lifeline is a nonprofit agency. We've been around since 1962. We're the largest provider of chemical dependency treatment in the county. So the majority of folks receive treatment through Lifeline. And we offer a broad range of services from detoxification, which I just mentioned, from residential treatment, which is a 30-day inpatient stay, to outpatient, which can range from 30 days to 90 days, depending on where the person's at. We offer mental health treatment as well, because a lot of these folks have co-occurring issues, where they have a mental health issue and a substance abuse issue as well.
Okay. Now in January, Lifeline Connections opened the sobering unit. Where is this facility located?
So all of Lifeline's programs are located at the Center for Community Health.
And that's on Fourth Plain Boulevard?
Okay.
Correct. And so there was some space available in that building, and we talked to some stakeholders in the community about what we could use this space for. And a lot of the stakeholders reported that there's issues with public intoxication. And these folks get picked up by law enforcement, by emergency medical services, and typically end up in the jails, in the emergency departments, and it's very costly. and these folks don't get the services they need. They go in, they get out, they're back on the streets again. And so the idea of a sobering unit was a short-term stay where someone could come in, not clog up these other systems, get the support they need, have a safe place to sober up. And it's a kind of a step before detox.
Okay. And when you're saying intoxication, sobering, would drug use also be involved in this, or is it strictly alcohol use?
This is drug abuse, this is alcohol abuse as well.
Okay. All right. How many beds are available in the sobering unit?
So we have 16 beds.
16. Okay.
It's a co-ed facility. We do have some overflow beds available. We have 4 overflow beds if we need to use them.
Okay. And again, the stay, how long do people stay there?
So Washington funds this program, the state of Washington. They fund a 12-hour stay in the program.
Okay.
So the idea is, once again, to get them in, try to engage them in counseling, other services, and try to get them to get the motivation to either step down to detox or engage in other treatment services.
Okay, so now is this a free service for the person coming in?
It is. So it's like I said, the state of Washington funds this,
Okay.
and it's for people who are residents of the state of Washington.
And do most people come through the door, or are they escorted by the police? How do people get to the sobering unit?
So currently we're seeing a lot of folks just kind of walking in, but we get them from many different areas. Law enforcement drops them off. We get folks that end up in the emergency departments and they put them in a cab and send them over to us. So from Legacy or Peace Health. We get people that are just dropped off by family. So a lot of different avenues into the sobering unit, and we just say, come here. More than likely we're going to have a bed for you. If you need our services, we're going to be there.
Now, you kind of talked about this a little bit, but let's expand on this. So before, if someone was picked up by the sheriff's office, they might spend the night in jail, or they might be spending time in an emergency room. What's kind of the cost difference between staying at your facility versus spending a night in jail, as an example?
Well, one number I can give you is with the cost at the local emergency department. The Washington State Hospital Association indicates that it costs $1,300 to serve somebody a day who has a drug and alcohol problem. A 12-hour stay at the sobering center costs $84.
Oh my goodness.
So you can see the cost saving there is just immense. And so it's definitely going to save our system money, but also, just as important, we're going to try to provide some wraparound services for some of these high utilizers that are in and out of these systems, and try to engage them and try to get them the services they need.
So not only are they just sobering up, you're talking to them,
Correct.
giving them information, diagnosing some issues.
Yes, that's a very important part of this program.
Okay. When you hear about the sobering unit, you think about the recurring people coming in over and over again. Is that the case?
So this program's been open since January 1, excuse me, and according to the data we have so far, about 50% have just stayed one time. So the other 50% are frequent flyers, we call them. But once again, that's to be anticipated. A lot of these folks have been in through the jails and the emergency department multiple times. And so it's going to take a lot of effort to really engage them and get them into services. Our approach is when they're ready to change, we're going to be there, and we're going to have the services ready to offer them.
And are you talking all types of people? You mentioned youth, professionals, or you're talking homeless. You're talking a wide range.
So it's adults, so it's not a youth program.
Okay, it's not a youth program. Okay.
So that's important to make clear. But the disease of drug and alcoholism affects a broad range of socioeconomic levels. So we do see homeless folks in there. We do see other individuals that used to have a job or who are employed. So it doesn't affect a broad swath of the society.
Okay. Now, are you regularly filling the 16 beds?
Typically, during the day we have beds available, but at night we do reach capacity pretty quick. One thing to note is that we haven't had to turn anyone away as of yet. So we are meeting the need currently.
Any plans for expansion?
Since it's a new program, we're going to kind of just test it out first and make sure that we're meeting the current need. But there'll always be discussions in the future around, do we need more beds, and how can we go about facilitating that.
Now, and looking at this, one unique thing was the sober unit actually has a community advisory board.
It does.
So, what's their role, and what types of people are on this board?
So this is because the purpose of this program is to really identify some of these folks that are costing the system a lot of money and they're hard to engage. We formed an advisory board for this program, so we could discuss some of these folks that are in everyone's system. So we have law enforcement representatives, we have people from the emergency departments on this board, we have housing folks, we have folks from the fire department as well, from Clark County EMS, just to once again to get in a room and talk about some of these individuals that we all see and how we can better engage them. So that's one of the exciting things about this program is this really in community engagement around some of these folks that are coming to this program multiple times and have been using the emergency department for their primary care, have been calling 911 multiple times. And so that's one of the great things about this program. We're really excited to kind of get this up and running and really start engaging some of these individuals that have been in our systems and using different avenues of support, maybe not as effectively as they could.
Okay. Now I'm going to throw in one added question just to talk, since we have a little bit of time left. The one thing I had read that the Affordable Care Act was getting more dollars for drug alcohol treatment. Is that the case? Are you seeing that here locally? What kind of impacts do you anticipate?
We do. In years past, we would always, on a yearly basis, spend all of the money that we had in our budget for treatment. And since the initiation of the Affordable Care Act and the ability for more individuals to be covered with health care and have access to treatment, we are actually spending less state funds because those folks are now Medicaid eligible. And so that has been a positive effect on the system.
Okay. Now, if people either need help or want information about the drug and alcohol treatment programs, where can they check?
They can check on the clark.wa.gov website under the Community Services Alcohol and Drug section. We do have information there on all providers in the community, and then each of the providers has, of course, their own website.
And just before we jump to that, the telephone number
Is
397-2130.
Correct.
Okay. And for Lifeline Connections, where can they call and check online?
So all our contact information, we have a direct line into our sobering unit. If that's a program you're interested in, it's just go to our website, www.lifelineconnections.org.
Okay. And now I had a number here, 800-604-0025.
Correct.
Okay. All right. Well, thank you both for meeting with us. It's an exciting
Thank you.
program, and I think it's going to make a big difference.
Thank you.
Appreciate
Thank you
it.
very much.